Welcome to the Longevity Formula with Dr. Brandon Crawford. Let's explore the new era of wellness.
Hey everyone, welcome back to the podcast. Today we're going to be diving into some really groundbreaking technology. I've got John Warlick here joining us today, the brain behind this technology that we're going to be talking about. We're really going to be exploring something called Softwave. The Softwave technology was something that my medical director, Dr. Madera, actually brought to my attention. She said, hey, Brandon, we're using this in various ways, mainly in regards to stem cells. And she said, with your demographic of patients, with everything that you guys are doing, you really need to look at this. This technology was something that I decided to quickly adopt. So I actually did review tons and tons of research. And that's the great thing, is that there is tons of research behind this technology. So, John, Mr. Warlick, thank you so much for joining us today.
No, I'm glad to be here. Thank you for the invitation.
So, if you don't mind, if we could get a little bit of background on you. You're not a clinician, right? But you've really spent a large part of your life developing this technology. Can you give me a little bit of background on yourself, please?
Yeah, our legal team will make me give a 30-second disclaimer. I mean, we are very cautious with the FDA, but we have multiple FDA clearances, and they happen to be for acute and chronic wounds. They happen to be for connective tissue activation. And most people would ask you what that means. And when I asked the FDA what that means, and we got our first FDA clearance, they said, don't ask. But it seems very important. That was our first FDA clearance. We also have it for acute, for blood supply, and for pain as well. We have a half dozen other indications in the pipeline, including ED for non-healing bones. A really exciting one is about to be FDA approved, our first FDA approval through an affiliate of ours, Dr. Tom Liu in San Francisco at UCSF, and that will be for stress incontinence. He showed a dramatic reduction in leakage at 16 weeks in a clinical trial that had 20 of the most prestigious U.S. medical centers. And then also, so a lot of stuff we're talking about, although there's a ton of research on it, we may or may not have FDA clearances. However, that connective tissue activation gives us a lot of leeway as well as pain and blood supply. Those are the most frequently used clearances when we're doing our research.
A lot of what we're going to talk about may be off-label use, so just so the listeners understand that. So absolutely.
And a lot of things, internationally, we have a whole lot more clearances and approvals than we do here in the States. Just the Europeans have been using this standard of care for 30 years. Everything we're talking about all goes back to Dornier. All this goes back to shockwaves for kidney lithotripsy. That was the first shockwave use in the United States. But up until 2004, everybody thought the mechanism of action for even non-kidney stone related pathologies was based on cellular destruction and trauma. Dr. Wolfgang Schaden, our medical director from Vienna, Austria, he discovered in that 4-year window while he was treating osteomyelitis patients, they had non-healing fractures, like a tibial non-healing fracture, and they had like a skin defect associated with that. And he was treating that with high energy shock waves, and he realized that the skin defects were going away, the wounds were going away, they'd been there for years and years. And the light bulb went off and said, these skin defects are being treated in the unfocused, low energy portion of the shock wave. But almost immediately he would see the wound become disinfected. He'd see the wound become pink and healthy, and in weeks it'd be perfectly healed. So then he hypothesized that it was not requiring a traumatic effect. He recruited me out of retirement. We got together our old medical team that had formerly been with Healthtronics. We brought them all back together, and we started this company called Softwave TRT. This whole industry's sound waves, okay, even ultrasounds gets looped into this universe of sound waves. We all know they're continuous waves like this, and they generate heat, which is good and bad. Primarily, it's about the peak densities of the pressure and the sound at which the sound travels. And so everybody loves to call themselves shockwaves because there's a lot of great shockwave research, but they're really just sound wave machines trying to catch the coattails of the very specific shockwave definition. Yeah, I mean, as you see in a shockwave, have you ever seen I can send a picture of it to you. There's a jet as it passes through the sound barrier.
Yeah.
It causes an expanding plasma bubble. That's a shockwave. Our medical director he's a backseater of that. Was it F-16s, the two-seaters? He said when you pass the speed, you could actually see that plasma bubble come off the jet.
Oh, that's cool.
Really cool.
So you get this shockwave, produced when that hits the tissue. How is that shockwave actually is it just going straight into the tissue? Is it being converted to something else? Like, how does that actually...
Well, the mechanism of action, if you wanted to study, this is mechanotransduction. It's converting energy into a biologic system.
Okay.
And most times pathology or disease states, it's lack of energy. I mean, we're just putting energy into a biologic system. It's just an efficient way to do it. And as you get older, the less energy is being, you're not walking as much, you're not making contact. So we're just putting energy into a biologic system in a very efficient fashion.
So literally the discussion around E equals MC squared, energy equals mass times the speed of light squared. So you're actually having an influence on both the energy side and the light side, right? Because my big thing is, you in order to change matter or mass and or energy, it's a light discussion, right? So we control light and we influence different wavelengths of light, but then also the timing of the light and all these different things. So you actually have light, but then you're also creating this plasma bubble, which is on the energy side. So you're influencing this equation at two sides, if I'm understanding correctly.
Yes.
That's a cool discussion. I was very, very intrigued at how you're producing the shockwave by using light that then transfers into sound, and then that energy is pushed into the body that way. So I know that you gave me an acronym the other day, and it was HEAL, HEAL. What did that stand for again? Can you walk us through that?
Well, sometimes it's a little bit corny, but it's true. We produce four kinds of energy. There's a heat component, there's an electromagnetic pulse, which is usually beneficial, as you see from all these PEMF devices. Then also we have the acoustic component, which is, we believe, the most important component, but also there's light. So if you just take the first letter of all that, I think I found it, it stumbled on me. We actually trademarked it. It's so heat, electromagnetic, acoustic, light. If you take it, add up to HEAL, but those are all four types of energy that we produce. Whereas the PEMF device only has an electromagnetic component, and a lot of these other technologies have one or two, but our technology is unique and that we have all four of those types of energy. And all four play a vital role in healing. I can't make a living saying light doesn't work or acoustic doesn't work myself or PEMF. They all are useful, but we just have the benefit of they're all in one package. We have a huge electromagnetic pulse. I mean, we underestimate the value of that because when we did our first FDA study for the oscillotron, when we had to do it randomized controlled, we only shielded and blinded the component to the acoustic energy. We put some styrofoam over the bellows and the patient couldn't see it. So we treated the patient, but we had these, even with non-healing fractures, 20 years old, we were getting in the placebo group, we were getting like 40% healing. In the shockwave group, we were getting 75% healing, but we had projected 5% for the placebo group because they're 20-year non-healing fractures. They're not going to get better. But what we didn't realize is we weren't blinding for the electromagnetic pulse that we did. And so it made our study went a whole lot longer because we didn't randomize correctly for the number of patients. But at the end of the day, we got, we proved in a randomized controlled fashion that we have a dramatic improvement for bone healing. But we also proved that electromagnetic pulse, as we all know, also is hugely beneficial for that.
Yeah. Well, and I've definitely felt it. I mean, it's quite amazing. Can you walk us through like how this is so, just the technology itself?
Yeah, there's several different types of shock waves. We essentially, underwater, we two electrode tips, almost like automotive electrode spark plugs, surrounded by fluid. We discharge it up to 20,000 volts across the gap. It evaporates a small amount of water very quickly, causes an expanding plasma bubble. On the leading edge of the plasma bubble, what also makes us unique is that it's essentially is a shock wave, okay? And it's in a millionth of a second is passing through the cells. And what it does is put shearing forces, put compressive forces, and it expands. But the other beautiful thing that we did that 90% of the other shockwave companies don't do, we put it with a lens so that every bit of energy that we discharge can be pushed in one direction. 90% of people call these things radial ballistic devices. They're two metal pistons that bang together and they cause a pressure wave, not a shock wave on the skin surface, but it goes spherically in 360 degrees. And so only that tiny bit of energy that's pointed at the pathology is beneficial. And you're wasting about 99.9% of energy. So you have to, almost like a mini stick of dynamite on the skin surface to get enough of that sphere directed in the right direction to have a beneficial biologic response. But because we chose a parabolic reflector, every bit of energy can get pushed in one direction. Every shock wave or even sound wave, regardless of how weak it is, passes through the body, hits air, turns around, and comes back.
Okay.
So every shock wave goes all the way until it hits air and comes back. The key about when you're talking about depth of penetration or penetration depth is having enough energy at depth to have a biologic response.
Yeah.
All of these 95% of machines sold out there very inexpensively are ballistic radial type devices. They're massagers essentially. But even though they generate a huge amount of energy on the skin surface, which is very painful, at 1 centimeter, anything after 1 centimeter, they don't have enough energy to have a biologic effect. Okay, but the key is by having the lens and electrohydraulic, which is a much more efficient form of the shock wave, we have enough energy up 12 and 14 centimeters to have a biologic effect. The only reason you turn up the energy level to higher levels is so you have more energy at depth. Even at our lowest energy levels, that shock wave goes all the way through the body, turns around, and comes back.
We didn't talk about this before, but plasma is something that really, really intrigues me. I love that your device does produce this plasma. Plasma in and of itself has this intelligence in it. Plasma is what makes up, from what I've read, from what the, physics people know, the majority of our universe. And it's very interesting how plasma can actually interact with the body. And now we're actually understanding that a lot of the cell-to-cell communication is actually plasma related.
It's interesting, though, because 2 years ago, we never would have mentioned it. However, what you just said, 3 years from now, we might coming back and saying, what were we thinking about sound waves that all was about the plasma?
Right.
It's funny how we've evolved. We know it works, but describing how it works is still a work in process.
Yeah.
And we will be learning for the rest of my life.
Yep. And that's how you know when you're on the leading edge, right? And that I think that's important for listeners to understand. And that's really what we're trying to do is we want to talk with the people at the leading edge.
We've been doing this since 1987. Okay, at energy levels at least 10 times higher, typically 30 to 50 times higher, a focused shockwave in the kidney. And we're averaging about 300,000 to 500,000 treatments in the U.S. alone since 1987. And every one of those treatments, you're treating an internal organ at incredibly high energy levels. And you could put an ice cube in a focal point and it would shatter the ice cube, okay?
Wow.
And however, we've been doing that. And every time you're doing it, you're treating large blood vessels, you're treating nerves, you're treating skin, you're treating everything, and nothing bad has ever happened. It's really inconceivable of how you could hurt something short of dropping the 50-pound box on your toe.
Right.
And the good news is if you do that, we can fix it. We make broken bones go away. In the States, we're regulated by the FDA, as we should be. But it's important to know is do no harm. That's the most important part of these discussions is it's really hard to hurt yourself with shock waves as generically and more specifically Softwave, which is a tiny little wedge of the shockwave family.
Yeah, I definitely know it works. I mean, my own personal experience, so I've actually had 2 back surgeries. I do have a torn meniscus. I have a torn MCL as well in my knee. I actually had my wife use the Softwave on my back. And I will tell you, I have never actually felt that much relief. It was like I had better mobility. The pain was like non-existent. I typically have this like area kind of around the right shoulder blade area that just feels like someone's stabbing me in the back. That was completely gone. And the weird thing is it's like one of those pains that I just was used to. My youngest son, actually, he'll get a migraine from time to time. And he actually came to my office. My wife had to go pick him up from school. And he was, had a migraine, did the Softwave, and it was immediately gone. His migraine literally.
Where'd you apply it?
I'm sorry?
Where'd you apply the
So
Softwave?
he gets this migraine behind his left eye. So I literally just did that left frontal lobe area.
Did you really? Okay.
And
the other way, most frequently it's applied, they will apply it there because they shouldn't, because of the FDA, maybe they should be, but very frequently for migraines, it's at the base of the skull. But in vasodilation, it seems there's a lot of reports. I've seen papers on that. So that's very interesting. And then also, if you really want to go out there, we've seen some really cool case reports for migraines. If you're trained in Eastern medicine and believe, which I do, in reflexology, replacing the reflexology, the pressure points, the manual pressure points with soft waves, we've seen some amazing relief by treating the fingertips for the brain as well. There's some really cool stuff we're doing just by treating the hands and blood, quite frankly. There's just that's the next frontier. Hey, I want to go back one thing. When you say it's your back, typically people say it's the back pain. It's not the lumbosacral spine so much as the SI joints that are usually highly inflamed. And you'll find, and it's funny, it's not the same spot every time. But when you find one, most people say, oh, I have this horrible back pain just on the right side. And you go over to the lumbosacral spine, it doesn't really hurt. But when you go to one SI joint that they say it hurts, the flank, it lights up like a firecracker. It's very uncomfortable for a bit, and then the pain goes away pretty quickly. But what they don't realize, it's always bilateral. When you go to the other side and do that, they're going to say, oh, no, it doesn't hurt over there, but it does hurt over there. So you have to treat both sides. But more importantly, though, that especially if you're a runner, I will promise you that in addition to treating the SIs, roll over and treat essentially the hips, especially the abductors. Just go over the entire area, and that'll be 3 times more painful than your SI joint.
Yikes.
And it leads to much more longer lasting pain relief in the back. It's the hips that are causing, the vast majority of the time, especially in women, it's the hips that are causing the back pain. The other thing I'll give, 90% of the time, if somebody walks into my office and says they have horrible neck pain, unless they've had a car wreck or something like that, it's coming from their shoulders. And physical therapists understand that's the whole thing about referred pain. That's probably what we do best. Anybody can be good with soft waves in a day or two just by treating the pain directly. But if it comes back, you've missed spots, and there's being trigger points or fascia that's been damaged somewhere else. And all the physical therapists on this is being referred from somewhere else. But for your personal biohacking, I promise treating your hips is going to be more beneficial than treating your back.
So we talked about how this is not painful. The Softwave you have the ability to turn the energy down, so it's not like...
The key is you diagnose on high, you find it. Because if you just go over at real low energy, you won't find the spot, okay? Because you have to have that depth of penetration. So I dial up to mid-range. I say diagnose on high, treat as the patient allows. I'm not here to hurt you, okay? We found the spot. Let's turn it down to where it's tolerable. They go, oh, that's fine. I can feel it. But I also have to tell them that if you can't feel it, it's not helping. And the more pain you can tolerate, the quicker and better you're going to heal. I meant to correct you too. It's not painless, but it's a whole lot less painful compared to anybody else. And we can turn it all the way down. It doesn't have to hurt at all, but it might take 4 or 5 treatments instead of 1 or 2 treatments. But we have to find the spot by finding the pain. That's the only difference.
Right.
We have it at a level to find the pain, because the neatest thing about this technology, I've had hundreds of people walk in with MRIs and say, I've been to Mayo Clinic and here's this MRIs, 3 different ones, and can you fix that? I go, it's probably not that spot. And so I'll put the probe on that spot. Doesn't hurt at all, but I'll go 3 inches away on a trigger point, and they'll go, wow. And when that trigger point's healed, the pain in your neck, for instance, goes away.
That's what I'm talking about here. So it's amazing technology. And with that little segue, and what has been the most fascinating, area of the body or thing that you've been like, oh, wow, I didn't realize that this could help this area of the body. Now let's go look at that. I mean,
when we talk about the mechanisms of action that are proven, and they're proven at the highest level, I mean, there's randomized controlled data on every mechanism of action. One, the first is the stem cells. Tom Liu at UCSF and many others have proved that the mitochondria and the resident stem cells light up within seconds, and they go to work. 2, there's stem cell migration within hours, and differentiation within days. So the stem cell mechanism, it's incredible, ultimately leading to a 300% improvement in blood supply at 12 weeks, small, medium, and large vessels in the ischemic heart. Okay, that's the most important mechanism. We bring long-term blood supply, new blood vessels, small, medium, and large. The second, and the most talked about, especially for pain, is our ability to modulate inflammation. Okay, we used to say for years we're reducing inflammation, but that's not true, because when we treat a non-healing fracture, somebody can have a 30-year-old non-healing fracture, they have no inflammation.
Right.
Inflammation's not bad, but too much is a good thing, is a bad thing. So we're actually on a non-healing fracture patient, we're wanting to turn on the inflammatory pumps. We've actually had a patient who had a 30-year non-healing fracture in his tibia. We treated that one day and turning on the inflammatory pumps, but because he'd been on crutches for years and years, his shoulders were horribly inflamed. We treated them, and then the shoulders were turning down the inflammatory pump. So our ability to modulate inflammation is the key buzzword. We can turn it up or down. It's a smart response. And then third most important thing is we're usually antibacterial, anti-infectious. We are treating infected knee implants, hip implants. At Piedmont Hospital, we're treating, there was a small series where they treated infected LVADs, left ventricular assist devices.
Mm-hmm.
And if you can't, this was after they failed everything else. And if we hadn't got rid of the infection, they would have had to remove that. And that's catastrophic, because that's keeping the patient alive.
Right. So
our ability to destroy bacteria might be the most important thing we do. And we've proven it 3 different ways. One, a ton of papers showing how we disrupt the biofilms mechanically. So the body's own blood supply can get there. 2, there's a peptide called LL37, which upregulated several 100%. That's the most antibacterial peptide. It activates in mass with shock waves. But most importantly, once again, is our ability to immediately bring blood supply so your body can, bring its helper cells, and permanently at 12 weeks, 300% improvement. Blood supply probably is the most important thing that we do. But knowing these 3 mechanisms is so hard. I'm going to challenge you. Name an indication that would not benefit either from stem cell response, modulation of inflammation, or anti-infectious bacteria.
Right.
That's where we get in trouble, because if people say, does it work for, I go, well, yeah, I can't, it's not FDA approved. However, there's a half dozen papers for it. And why would it not work? Because most importantly, when you said the most exciting thing is this study took over almost 25 years. The European Heart Journal, this came out, is we've been doing this for years and years with the Austrian healthcare system, but finally got published. It should have got published in Lancet. One editor pushed back. Everybody else said yes, but Lancet turned it down by 1 vote. But it went to the European Heart Journal. When they cracked the chest during bypass grafting, if you've had a heart attack, you have a scar on your heart. Okay, and your ejection fraction, we were treating only patients with like 25, on average, I think it was 28 was the ejection fraction, which is very low.
So at 28% ejection fraction, you're actually in heart failure, right?
Yeah, that you're on oxygen to get up and down stairs.
Right.
You can't walk 100 yards. It's your quality of life is shot.
Right. And so what were the results after applying Softwave to these people?
Well, the Europeans, because they're not good salesmen, they tell everybody that they raise the ejection fraction an average of 12 points. Okay, 11 if you take the most conservative, and that just doesn't sound very good. Okay, but when you take 11 over 20, it actually was 38 points. Okay, so your ejection, and that's a single treatment at 12 weeks. The ejection fraction, and the different they took. BBC did a 30-minute special on us. They interviewed the patient a year after his treatment. And he was running in a 10K race. The BBC interviewer, how's it help your heart? And he's sort of looking at her.
Wow.
I'm running a 10K. What do you think?
That's
so
amazing.
Dramatic improvement in lifestyle. But the most important part that they did not even publish, which really is the most exciting thing about our technology, is they never could have done it here, but in human clinical patients, in German, Austrians, when they cracked the chest, they took a biopsy of the ischemic heart immediately when they opened you up. Then they applied 15-minute Softwave treatment. Then they did it immediately a biopsy again. And they were able to show all the known genes responsible for tissue regeneration lit up like firecrackers. We were able to turn on all the genes responsible for generation in a matter of 15 minutes. And that's why this is really biohacking. We are now having a genetic response. We are turning it on and off the genes responsible for tissue regeneration.
Wow.
And that's why we're so excited. This one study single-handedly. Because also, if you're now treating, the energy level I use was like 0.37 millijoules in the heart focused with our old focus probe. But that's just because the study started before we knew any better that unfocused worked better. But they had to continue the same energy settings or they couldn't use the data because it lasted over 20 years. But they showed even with high energy focus shocks directly on the beating heart, we were able to have this huge, improvement in the ejection fraction as well as what you see with the genes being responsible for generation lighting up. And the data was accepted and peer reviewed showing that the 300% improvement in blood supply in the ischemic heart at 12 weeks.
That's just amazing. And so a lot of...
Well, I'm excited about everything. What does not benefit? Because in leading into your segue, one, we don't have any FDA clearance for the brain, but my number one most exciting thing that I'm spending my time on is the brain.
Yes.
And Alzheimer's, dementia, Parkinson's, because we don't understand that, but we know we modulate inflammation. We have 300% improvement in blood supply. Another example I give, we have pictures of people who've had tummy tuck surgeries 10 years ago. It's a nice red and raised scar. We treat half and it's 80% reduced at 12 weeks. So we can remodel scarring, even old scars, okay? Yeah. And we have an amazing effect on the lymphatic system we've proven now, or the glymphatics as they're in the brain. And a lot of people are starting to think it's the glymphatics that are, responsible, that you're not draining all the toxins out of the brain.
Right.
So any of the theoretical known causes of all these brain indications, we've proven that we can be very, very useful for managing each of those. So why would you not try that? So we're going to spend the vast majority of our time and research budget exploring the human brain here going forward based on all that we know about the underlying mechanisms of action.
Yes. And that's obviously what really excites me. And that's where we've been using the Softwave quite a bit, honestly, more than anywhere else, as far as like where we're applying it on the body. We're doing it on the brain, and we're doing it for brain rehab. Well, man, this is just an amazing, I mean, we could talk for another, couple of hours. I think, I mean, you're just a wealth of information, but before we kind of wrap things up, is there anything else that you'd like to communicate to the world? Is there anything that we didn't touch on that you'd really like to tell the audience?
No, it's the most important thing we do is patients that have hope. I mean, chronic pain is horrible, wears people down. And just knowing that there's something out there, don't give up. It's a challenge, and I get in trouble every day because people want to call me and say, does it work for, I say, first thing, well, it's not FDA approved for this. And how I answer it is, if it was my daughter or son, I would do it. I do it myself. I treat my forehead and basic skull. I've had 20 concussions in my life, so we're doing some concussion research. It makes all the sense in the world. My dad passed because he had multiple concussions, so going back, it's safe. However, I still can't make certain claims.
Yeah.
But why not try it? We're doing hospice, but how we do it with all the time under compassionate use, when they've given up all other hope, why not try?
Yeah.
And more often than not, you go, wow.
Right. Yeah.
and then now we got to say, well, gosh, how do we not tell people about this?
Exactly.
It's a challenge. The FDA's, if they have a jail, I'm going to end up there one day, I imagine. It's hard to share, knowing as safe as it is, it's hard not to share the story.
Yeah.
And now that our company's so valuable, it didn't used to be, so I didn't mind. I had nothing to lose, but now all of a sudden I have lots of shareholders, and
yes.
so I have to be much more careful. But it's
right.
Really
well.
And you've seen it yourself. I mean, you're comfortable after this reading. You saw that it's safe. You very quickly got beyond the concern factor, and really the only risk is, and that I must tell anybody, we're not going to cause any injury, however. But when you're treating somebody with Alzheimer's, they're not healthy people, okay?
Right.
And I've had this happen. I've had an amazing recovery on a friend and family. They had been incommunicative for years. They had an amazing 90-day recovery, and then they for some unforeseen reason they had a seizure, okay?
Mm-hmm.
And if they were, and I don't have any research to show that it doesn't cause seizures and Alzheimer's pain. I don't have it. There's never been an effect that's caused seizures anywhere. However, because of lawyers and things like that, you just have to be cautious, because these are unhealthy people. If coincidentally something happens to them 6 months after you've done a series of treatments, and we don't have any randomized controlled papers, that it's intimidating, because you have to protect yourself. So you have to have other releases, the compassionate use, because it's so tempting to do something so easy and so beneficial. But make sure you cross your T's and dot your I's and protect yourself.
John Warlick, I really do appreciate this conversation. I appreciate everything that you're bringing to the world. You're really helping people that have been suffering immensely. And I've seen it firsthand, people suffering, and literally the suffering stops in a very, very short period of time. But it's not just symptomatic. It is restorative, regenerative.
It's fun. And next time there's a paper, it's about to be published, about extending the length of the telomeres under the influence of shockwave.
Excellent.
So that's a soon to be published paper for anti-aging. When you said the biohack thing, I thought that might be useful.
That's amazing.
I'll have that publication here next time we talk. That should be really exciting.
In the meantime, thank you again for listening, and we will talk to you next time. John, thank you so much.